So today we're going to be talking about surgical asepsis. So we just talked about medical asepsis and the difference between surgical and medical, but now we're going to go into more depth on what exactly surgical asepsis is and how to perform sterile technique or aseptic technique. Okay. So again, what is surgical asepsis? So this is the procedure that maintains an area or object free of all microorganisms. So for medical asepsis, we were mainly just trying to prevent spread of any disease-causing microorganisms, trying to keep things clean. But for surgical asepsis, we are trying to, it's has to be free of all microorganisms in order to be considered surgical asepsis or sterile. Okay, so some basic principles of surgical asepsis is sterile to sterile. So if you are working in a sterile field, you have sterile gloves on. If you have your sterile gloves on, you can touch the sterile field. But you cannot touch anything outside of that. Even if it's considered quote unquote clean, it is not sterile. So then your sterile field would then be contaminated. So only touch sterile to sterile. Outside of the sterile package is contaminated. And then the 1-inch border of the sterile field is also considered contaminated. So that 1-inch border of your sterile field is not considered sterile. You kind of use that to open it up. You can use that 1-inch border before you have your sterile gloves on to kind of open up your field, get everything situated. So that is not considered sterile. If your sterile field becomes contaminated, or if it becomes wet, if it's not like plastic or something that is waterproof, then it is considered contaminated because those little microorganisms can travel through, the liquid up into your sterile field. So if you accidentally get something wet on your sterile field, say it's on a sterile drape or something like that that's not waterproof, even if it's sterile water or something like that, it's still going to be considered contaminated because any microorganisms that are underneath that sterile field can travel up through that water solution, whatever, into the sterile field. So if our sterile field becomes wet, besides something that's waterproof like a plastic or something like that, then it is not considered sterile anymore. Sterile objects must stay above the waist level. So you've probably seen on Grey's Anatomy and other shows whenever they scrub in to go into surgery, they do the scrub and then they keep their hands up above their waist level. That's because they are trying to maintain sterile technique. Anytime you drop something below your waist, drop your hands below your waist, they're no longer considered sterile. So at that point, they are contaminated. You need to change your gloves, okay? Because you can't see below your waist very well, and so that way, if it's above your waist, you can see your hands. You can, help make sure that you're maintaining a sterile field. So if you drop your hands below your waist, that's considered a break in aseptic technique, or sterile technique. No coughing, sneezing, or reaching over the sterile field. So microbes can travel through gravity, so it's very important that we only reach over our field with our sterile gloves. So if we reach over and our whole forearm is going across the sterile field, and we don't have like a sterile gown on or anything like that, then that would be a contamination of our sterile field. And then, of course, talking, coughing, sneezing, those are all going to introduce microorganisms into that sterile field, making it no longer sterile. Never walk away from your sterile field or turn your back on it. You have to have it in your vision at all times, peripheral vision, direct vision. So if you walk away or you turn your back on your sterile field, it is no longer sterile. You need to get a whole new sterile field. Okay. You can use dry sterile forceps when necessary. This is just a tool to kind of help move things into your sterile field. So if you needed to for whatever reason, you could use some sterile forceps to do that. So remember, for surgical asepsis, this is when we're doing some kind of invasive procedure. A lot of times you'll do a sterile dressing change for surgical incisions, and we'll kind of talk about that more when we talk about our wound care lecture. But it's very important to maintain sterile technique to prevent an infection. And then, of course, for surgeries, they do this because they're opening somebody up. You don't want to introduce any kind of microorganisms that shouldn't be inside of the body that can cause infection. Also, a big one is Foley catheters. That is definitely a sterile procedure. The urinary bladder, we don't want to introduce anything to cause an infection there. So there's different techniques, and y'all will go over this in lab, or different procedures that have to be sterile in order to prevent infection. Okay, so again, our sterile field, when I say sterile field, I'm talking about the area that we have prepared that is sterile that we're working off of. It has to remain sterile, or else sterile technique is not maintained anymore. So this is a microorganism-free area because this is surgical asepsis. So this is a field established by using the innermost side of a sterile wrapper or sterile drape. So for most of your sterile procedures that you're going to learn in lab, you will have you'll use, for the most part, you'll use like the inside of the package. So for example, for your Foley catheters, you'll have a Foley catheter kit. The outside of that kit is not sterile, but once you open it up, you open up your sterile field, the inside of that is sterile. So that would be your sterile field. It'll make more sense when you're actually doing this in person. And usually in class, I bring a Foley catheter kit so you can kind of see what I'm talking about. It's hard to explain just in words. But sterile supplies and solutions can be placed on the sterile field. So anything that is sterile, you can put it on the sterile field. Sterile forceps or gloves to handle and transfer sterile supplies like we talked about. Okay, so when you are opening a sterile field or package, there is a certain way that you have to open it to make sure that you are not contaminating the field. Because again, microorganisms can, travel through gravity and fall onto the sterile field that we would have no idea did that. So we want to make sure we're not reaching over the sterile field. So first and foremost, you want to make sure that the package is clean and dry. So if it's wet, then it's no longer sterile. You want to first open this flap away from you first whenever you're opening your sterile field, because that's going to help prevent you from reaching over the sterile field once it's all open. Then you're going to open the sides, and then you're going to open what's towards you last. So this is the best way to do it to make sure that you're not reaching over the sterile field. Okay, and then adding items to the sterile field. So we've got our sterile drape out already, and we need to add items to it. There's different ways to do it. We can use sterile forceps or tweezers, something like that. You can see that in this first picture there. They don't have sterile gloves on yet, but they are using something that is sterile to move sterile gauze or whatever into the field. Next, we can open up sterile packages and drop them on the field. So we just have to be really careful with this. just try to drop it over the field, kind of open it not over the field, and then once you have it open, you can drop it in onto the sterile field. And then, of course, if we need to add some sterile solution, so you can see on this last picture, it looks like they're maybe about to do some kind of suctioning. That they've got a sterile drape down, and so that doesn't need to get wet, but it looks like they have a little plastic container there that they're pouring sterile water into, and that's perfectly fine. So some important things to know about any sterile solution or sterile water that you're using for a procedure. When you first remove it out of, the supply Pyxis, you want to make sure that it's not expired, of course, and then you want to make sure there's no damage to the bottle that could cause it to be contaminated. So whenever you first get it out, you need to write on there, when it was opened. And then whenever you first open it, you don't have to lip it. I'm going to explain what that is in a minute, because it's all sterile right now except for on the outside. Whenever you pour, you always want to make sure that the label on the bottle is to the palm of your hand. So that way you're pouring the same way each time. It also helps prevent that label from getting wet, to where someone can't read it to know the expiration date, or where you wrote on there that you opened it. So, say we've been doing this procedure, already, this patient has it scheduled. We've got some sterile water in the room that's already been used. It's perfectly fine to keep using it as long as it's not expired, but we need to lip it first. So that means if we've already got some that's been used prior, then we want to open it up and then pour a little bit into the trash can. Again, making sure that you have the label on the bottle to the palm of your hand. So we're just going to lip that just to make sure that how we're pouring it in will be sterile. So it's just kind of an extra measure to make sure everything's remaining sterile. And then we can pour it into that, that little container or whatever we're pouring it into. Okay, and then this is on opening a sterile glove package. Again, this is going to make a lot more sense when you do it in person, but kind of same concept as the sterile drape. It's just kind of folded up a little bit differently, but remember the outside of it is not sterile, and then that outer 1 inch is not sterile. Okay, so it's going to be kind of folded up. You're just going to open it up. You can see it has left and right on there, so you know how to put them on. And then you're just going to grab that little outer flap and open it up like that. Okay, and then whenever you're putting on your first glove, you're going to put it on your dominant hand first. So I'm right-handed, so I'm going to glove my right hand first. So you can see in this picture, the nurse is grabbing the inner part of the glove, and that's fine because whenever you open it up, you can see it's folded up. So you're only going to be touching what's going to be touching your skin anyways. So he's using his non-dominant hand to glove his dominant hand. So then he's got his right hand gloved. So he can touch any of this part here, but just not the other parts or the outside, like the fingers and things like that. Okay, and then you're going to glove your non-dominant hand. So for me, it would be my left hand. And then you're going to grab inside of the cuff because that's going to be what's going to be on the outside, so it needs to remain sterile. And then we're going to put that on and then just release to make sure we're not touching our skin or anything that would contaminate our gloves. And then just important to note that any sterile procedures cannot be delegated to unlicensed individuals. So patient care techs cannot do any kind of sterile procedure. So just that's important to remember. When in doubt, don't delegate a sterile procedure. Okay, so here's some scenarios about maintaining sterile technique and what we need to do if this happens. So, for instance, an item added to the sterile field falls close to or on the edge of the field. So remember that 1-inch border of the field is considered not sterile. So if we have, a sterile gauze that we're using for a dressing change and we've dropped it on the edge of our sterile field, then it is contaminated. So what we would need to do is not use that item if it falls on the sterile field, okay? Or falls on that outer inch of the sterile field. Okay? And then what if part of the sterile field becomes contaminated? Say we reached over, maybe we spilled something on it, maybe the patient touched it, then we are going to get a whole new sterile field, okay? We're not going to just use half of it or the other half. If the sterile field is contaminated in one area, the whole thing is contaminated. So you have to get a whole new sterile field. Let's say you get into the patient's room, you've set up your sterile field and everything, and then you realize that you forgot something that you need for the procedure. Now, remember, we can't leave and come back, because if we turn our back on the sterile field, it is no longer considered sterile. So if you happen to have someone in the room with you, which is always nice if you're doing a sterile procedure, but that's not always feasible, they could go grab it for you. Maybe you haven't got your gloves on yet. You're still looking at your sterile field. You could call somebody over your, Vocera, whatever device they have in the hospital, walkie-talkie, to get a hold of somebody and see if they can bring it to you. If not, you're going to have to leave and come back. So you need to just get rid of that sterile field and you're going to have to start all over. So if you've got somebody with you that can go grab it, great. If you absolutely cannot get a hold of anybody, you're going to have to start over. So that's why it's important to make sure you have everything you need before you go in a patient's room. Okay, so say the patient touches the sterile field, especially if you're doing like an abdominal dressing or something like that. Maybe if it's a child or if it's somebody who's maybe confused, or maybe it just hurts and they grab it not thinking, you want to, then that field is no longer sterile. So you want to make sure you educate your patient, that this is a sterile procedure. Please try not to touch anything around here. We're just trying to help make sure that we don't cause an infection or anything like that. But if they do touch it, then your sterile field is contaminated because your patient is not sterile. And you'll have to get a whole new sterile field and start over. Okay, and then we're not doing the Nearpod quiz since this is a recorded lecture, but I will be posting a quiz for the surgical asepsis and the medical asepsis content. Please feel free to let me know if you have any questions.